BMI, percent body fat, body composition, what's the difference? Don't they all just mean the same thing, whether I'm carrying too much adipose tissue or not? In this video, I'll discuss the subtle but often overlooked nuances among these anthropometric terms and talk about why they are not interchangeable. Additionally, I'll briefly review some of the techniques that we use to assess body composition. The tools that are used to measure the physical size and proportion of the human body are methods used by scientists in the field of anthropometry. For example, a stadiometer is used to measure standing height, which is used to measure an individual's length or size, whereas ratios of body weight to height are used to indicate body proportion. An example of measuring body proportion is that of body mass index, or BMI for short. This is where the person's weight is divided by the height squared and is commonly used to categorize someone as underweight, normal weight, overweight, or obese. It has been well established in the scientific literature that as BMI increases above 24.9 kilograms per meter squared, the risk for cardiovascular disease, dyslipidemia, hypertension, type 2 diabetes, hospitalization, and mortality all increase. Since BMI requires simple tools and is easy to measure, it has been widely adopted by clinicians in assessing disease risk, as well as being used as an indicator of body fatness. While BMI is a useful clinical tool, it is not an anthropometric measure of body fat. Just think about how you acquire the data used to calculate BMI. It is solely based upon an individual's weight and height. No physical measure of the amount of fat or adipose tissue is included in the BMI calculation. It is therefore limited as an indicator of an individual's body fatness because the calculations do not consider body composition, which in its simplest form is the amount of muscle mass and fat mass that a person has. In addition, age, ethnicity, muscularity, and skeletal frame size all affect the association between BMI and body fatness. The assumption is that people with BMIs above 24.9 are disproportionately heavier because they are carrying excess fat mass. In reality, this assumption is not universal to all individuals. For example, an athlete who has a large amount of muscle mass might be considered obese by BMI standards. Is that a bad thing that warrants clinical intervention? Of course not. But if BMI misclassifies certain individuals, then what are we to do as clinicians looking to assess someone's risk for disease? Well, that's where specific anthropometric techniques are used to more precisely determine an individual's approximate body composition. In other words, body composition allows us to further examine the amount of muscle mass versus fat mass. Scientists in the field of body composition have 7 different models that attempt to quantify the human body at an atomic, molecular, cellular, tissue, or whole body level, depending upon the technique used. The relatively simplest and most common model is the Two-Compartment Model at the whole body level. This model measures the amount of fat mass versus the amount of fat-free mass that an individual has. So, if we obtain a person's weight and measure the amount of fat mass, or the quantity of fat-free mass, we can determine a person's body composition using simple mathematics. For example, if an individual weighs 150 pounds and their fat mass is determined to be 15 pounds, the person has a fat-free mass of 135 pounds. Essentially, the person has a body fat percentage of 10%. As you may be aware, there are several anthropometric techniques available that use this two-compartment model to estimate an individual's percent body fat based upon their body composition. One of the most widely used being skinfold measurements, whereby special calipers are used to measure the thickness of the skin and subcutaneous fat at various site-specific locations on the body. These measurements are then used to estimate body density and convert it into a body fat percentage. Thus, fat mass and fat-free mass can be easily calculated. In the hands of a talented and skilled tester, this technique yields good results on par with that of an MRI. Just keep in mind that the results can be affected by the type of calipers used, hydration status, exercise timing, muscularity, degree of obesity, and generalized swelling or anasarca. For decades, the two-compartment gold standard for determining body composition has been underwater weighing, also known as hydrodensitometry. This was the technique to use in research studies and yielded fantastic results. In its simplest form, all that is needed is a scale and an apparatus capable of supporting a human being underwater. The technique uses Archimedes' principle that a body submerged in water is buoyed by a counterforce equal to the weight of the water displaced. In other words, the loss of weight in water allows for the calculation of body volume. So we then can calculate body density by taking a person's mass or body weight on land and dividing that by the body volume determined underwater. The greatest source of error with this technique occurs with the mathematical conversion of body density into a percent body fat. Another source of error includes accounting for the amount of air held within someone's lung and gastrointestinal system as they are weighed underwater. The more air that is held within the lung, the more buoyant a person becomes, and thus results in less weight underwater. This subsequently leads to overestimating the person's body volume. A person that is lighter underwater will have a lower body density and thus a higher percent body fat. Conversely, a person that is heavier underwater will have a higher body density and thus lower percent body fat. Other sources of error include being comfortable in the water, menstruation status, hydration, meal timing, and exercise timing. In more recent years, air displacement plethysmography, also known as the Bod Pod, has become a popular two-compartment alternative to underwater weighing that yields impressive results. Instead of using water, this technique uses air displacement to measure body volume. The downside is that this technique utilizes specialized equipment that is cost prohibitive for many facilities. Other notable two-compartment techniques for body composition include taking circumference measurements and skeletal diameters, which can then be used to mathematically predict a person's body fat. However, these techniques are less accurate than the other anthropometric techniques that I previously discussed. Moving on to three-compartment models of body composition that analyze the amount of fat mass, muscle mass, and electrolytes in body water, we begin with an easily administered technique called Bioelectrical Impedance, or BIA for short. You may have seen this method advertised in some weight scales such as those made by Tanita. This technique passes a harmless, non-invasive low-voltage current through the body, and the amount of resistance or impedance to the flow of electricity is measured. Don't worry, you're not going to get electrocuted. Electrolytes in body water and muscle mass are excellent conductors of electrical current, while body fat and bone are poor conductors of electricity owing to a low electrolyte content. These differences in electrical conductivity allow the tester to estimate body fat from the impedance measured by the device. The higher the impedance or resistance to the electrical flow, the higher the body fat. This technique yields similar results to Skinfold measurements if the protocol is strictly followed. Considerations such as the type of BIA used, the timing of eating, drinking, and exercise, hydration status, electrode placement, body position, menstrual cycle phase, and room temperature all need to be standardized to optimize the accuracy of this technique. Dual energy X-ray absorptiometry, or DEXA for short, is another three-compartment model that analyzes the total bone mineral content, lean tissue mass, and fat mass by emitting low energy and high energy photons from an X-ray tube. The device works by measuring the attenuation or loss of photon energy through the body due to the varying density and chemical composition of various tissues. DEXA scans are typically used to measure an individual's bone mineral density. However, in research studies, it is used as a highly accurate method of determining a person's body composition. Owing to the high cost of this machine, it is not a common method used in the field of anthropometry. Computed tomography, or CT for short, works in a similar fashion to DEXA scans. However, it exposes a person to higher doses of radiation and only provides localized body composition assessments. While it may not be feasible for routine determination of body composition, clinicians may be able to provide patients with an opportunistic adjunct assessment of body composition when CT scans are used for conventional diagnostic purposes. This technique is highly detailed and accurate as an anthropometric technique. Magnetic resonance imaging, or MRI for short, is a multi-compartment technique that uses electromagnetic radiation in a strong magnetic field to excite hydrogen nuclei of the body's water and lipid molecules. Each of the nuclei emits radiofrequency signals that allows for a highly detailed and accurate quantification of muscle mass, total fat, and subcutaneous fat. Once again, the prohibitive cost makes this method of anthropometry one that is reserved as an opportunistic adjunct when the MRI is used in conventional diagnostic clinical imaging. Each of the techniques described in this video have advantages and disadvantages. The technique of choice comes down to cost, ease of use, comfort of the patient or client, and practicality. It is more important that the technician be highly skilled and proficient in the method used regularly to assess an individual's body composition rather than becoming fixated on the method used. Ultimately, body composition is an important tool to assess a person's risk for disease and provides the clinician with a method to track the progress of a weight loss program. While a precise percent body fat that optimizes health is yet to be determined, the general consensus is that a range of 20 to 32% for women and 10 to 22% for men is satisfactory for good health. If you have any questions about body composition or any other topic, please contact your instructor for clarification. We are all here to support your educational needs. Thanks for watching and have a healthy and productive day.